I am so grateful you ladies are here joining us, and gentlemen, because we have Dr. Sandhu from Amelia, Tampa. Do I say Tampa or Tampa Bay?
It's Tampa.
This
Tampa sounds great. Tampa
Tampa,
Bay is the
Amelia,
area, but
Tampa.
Tampa's the city.
And I am really grateful he has donated his time to answer some questions that we have pulled from the community. Actually, lots of questions. Specifically on this topic, there has been a whole trend around, or a lot of conversation around smaller implants. Isn't it? It's like, oh, bell bottoms are back in, or now low rise are back in. Well, now we're talking about smaller implants again. So we're just
Yeah.
following the trends. And I'm excited to pick your brain because there are some nuances and questions specifically that the community has had. So I am really grateful for your time today.
There's lots of questions. Hopefully, I have lots of answers, and I'm super excited to be here. So thank you all for having me. This has been
You
fun
do,
to
you
talk
definitely
about.
do. Well, it's a conversation. You and I were just having this conversation.
Yeah.
It isn't always a black and white answer, especially when it comes to implant sizes, which is kind of what we're talking about. It is totally, I even thought on my drive in today, I'm like, I wish I could make a quiz that helps women determine what size they want it to be. Because I've had my implants for 23 years now. I've been in the 200 range, the 300 range, the 400 range. Now I'm gonna maybe exchange them back down to the 300 range. I've
Uh-huh.
had kids with them. I've lost weight with them, and and I love helping women decide what the right size is. But at least for my age right now too, I'm like, oh, a smaller implant may hold up longer over time. So that's something I wanna talk to you about too. But do you feel like in your practice in Tampa, you're seeing a little bit more of this trend around smaller implants?
For sure. We're definitely seeing a lot more of them. I think it's so interesting you mentioned like how trends come and go and they come in waves, and definitely right now we're seeing this smaller volume kind of more natural athletic thing, kind of
Mm-hmm.
aesthetic come into popularity, which is good because those are surgeries that I really enjoy doing. And but there
Mm-hmm.
are some nuances that we need to talk about, and I think it's worth discussing. Why is a small volume augmentation different than a large volume augmentation? Who's a better person for those, and
Mm-hmm.
uh, who can expect, what kind of result based on their baseline anatomy? And so we're definitely starting to see them now. I think
Yeah.
the Preservé wave is probably also encouraging some of that
Mm.
as well.
Mm-hmm. Well, we can
And
touch on
so,
that too.
yeah, for sure. Let's touch on that because I think it's
Yeah.
it's really cool to see people and what their results are with that.
Yeah.
So,
Why do you think, like, any ideas why you think it is moving this way? Like, I'm curious if it's certain celebrities right now. Is it like a fashion, whatever? I am curious because even me mentally, I'm like, oh, I don't want that heavier, maybe the outfits. I don't know. It's less about cleavage now and more about something else. I'm just curious if you've
I,
seen the same pictures coming in of goal photos or anything.
I mean, I wonder if it's just like the gestalt of like America, like, and just like the world at large, like just like going
Mm-hmm.
through in general, there's a lot of weight loss that's happening, I think. First of
Mm-hmm.
all, with the
Mm-hmm.
advent of GLPs, and I think people's frames are becoming smaller with
Mm-hmm.
the addition of that, and I think that that might be contributing. But just like anything else, we're talking about small volume implants right now.
Mm-hmm.
Probably in maybe 6 to 10 years, we'll be talking about why large volume implants are back
Yep.
in trend right now as well. So whatever the trend is, we're happy to help people get, figure out, if that's a right fit for them.
Yeah.
But for sure, right now, I think like I'm guilty of this, like athleisure, and like kind of like
Yep. Yeah.
just like dressing in fitted clothing, subtle cleavage. Like this is, I'm seeing these things a lot. I'm seeing these things a
Yeah.
lot. I'm seeing them consistently.
My loose correlation of me wanting to downsize a little bit is because of global warming. I pretend and like I am so tired of being so hot and sweaty.
Yeah,
I want to wear no bra, the
yeah.
loosest thing possible, and I want less support. And I don't see that changing. I know it's hot there. It is, 100
It's
degrees again here today.
this for sure. It's like about 92 degrees, but we also obviously have 100% humidity here, so it feels like 105 or something like that. So I
It
joke here in
is
Florida,
awful.
yeah. I mean here when you can always tell the people in the summertime who are not from Florida because they're the ones who are actually outside. Because we Floridians
Yeah.
we treat the summer like people in Nebraska treat winter. It's like don't go outside. Just stay inside, stay around the AC at all times. And so for sure, I think that that probably has something to do with it.
Yeah. Well, I like to get out and walk, and with these implants and this summer, I am ready
Hmm.
to get a little smaller too. So, yeah, I just
Hmm.
had my consultation. So, this is all in my head too right now. So, I'm really excited to talk about it.
Yeah, let's talk
Um,
about it.
what are, what do you consider a small implant? And like, what are the sizes too? Like, I know a lot of women, Bustmob, are aware sometimes this kind of 120, 125 cc's kind of translates to a cup size. So I never heard of women doing 200 or 100 cc's before. How
Hmm.
small can we go? And at what point do you tell women, I don't know if that's worth it, or you're not going to see a result, or how do you navigate that conversation?
In general, volumes, you're going to hear a lot of caveats out of me today because, especially when it comes to implant volumes and smaller volumes on different types of frames, it depends is the short answer. And I could answer every
Mhm.
single thing that we asked today with it depends. But there are some trends that I think that we can kind of establish. In my brain, small volume augmentation probably lives somewhere under the 250 to maybe 280 cc range.
Mhm.
Um, if that number starts with a one or a two and someone comes in and they feel really strongly about that, I'm like, okay, let me switch on like small volume augmentation brain.
Mhm.
Once that number starts to trend towards the threes, I'm like, okay, depending on the person's frame and their goals, it's more of a moderate volume augmentation. Um, and so I think that in general, big picture is probably what I'm looking at.
Mhm. Do are women goal photos, which I think are always the best way to explain what I want. I am the infamous. I brought in a picture of a Playboy bunny to Dr. Davis at my first time, but then I used the word I want to look athletic,
Mm.
and I got 275 cc's, and that was way smaller than what I wanted. And I realized, we should have probably worked on pictures more versus my
Hmm.
words. Because I do think women often say, well, I want natural, but then they bring in an augmented picture. So
Hmm.
how many goal photos should women bring in? How do you go through those with them and kind of explain, like, we're looking at proportion, or
Hmm.
how do you help with goal photos?
Golf photos are they're really important, but they're also hard, and that's why it's important to bring them and talk through the things. The word natural. If if I if you talk to five different women about what the word natural means, it means something really distinct to that human, but that is also going to be five different things that I get from five different women. And so, I guess to answer your question in a couple of parts, the number of goal photos, it depends on, really what you feel like you need in order to show the thing that you're wanting to show. That being said, it is probably helpful to have more than like one single person. Like if there's one person who you're like, I love
Mhm.
this person's look, I found this person on Instagram and they're exactly what I want, and I have like eight different photos of that same human, it's not as helpful. I like to see a little
Mhm.
bit of variety on different types of body shapes as well. I think that can help guide the conversation a little bit more. So, probably having at least a few different photos from a few different people that feel reasonable is really important. So the answer is probably more than like two photos, but it's also probably less than like 25 photos because at that point it starts to blend a little bit, and it's, there can be nuances and differences that get lost when there's too many photos. When it comes to the actual goal photos, what are we looking at? How do we look at things? How are we interpreting them? One of the very first things that I will look at when someone brings out their goal photo is I look at the top half of their breast here and I see, hey, what kind of look are we looking at here? Because in my brain, when I think about the natural versus augmented, that starts up here on the top half of the breast.
Mhm.
And so that's the first place that my eye goes. Hey, do I see a very gradual transition from the breast to the implant? Am I not really seeing that shelf, or am I seeing that really nice round
Mhm.
distinct shadow? Because that can really help to initially guide the conversation. Because as you said, some women say, "Hey, I'm looking for natural," and then they see that really nice round shape. Because that could mean to them natural in a push-up bra,
Mhm.
which can provide that
Mhm.
shape. So upper pole and kind of upper half is the first thing I look at. Then the next thing that I really look at is like, what is the general volume relative to this human's frame? Like, is this like a really subtle enhancement? where like you can't really tell that there is something there or isn't something there. Or it's like, oh no, there's volume there. There's an implant. No one's going to pretend that there's not an implant there.
Hmm.
And so these are like the two big picture things that when someone brings in goal photos, I'm like, okay, great. Let's look at the top half. Let's look at that upper pole. And then number two, let's look at just globally, how does that volume look on that person? Does it look,
Hmm.
super proportionate? Does it look relatively large? Those kinds of things.
Yeah. This sounds like such a weird question to ask. So, do you prefer nude photos, or like, is it more helpful
Yeah.
for it to be a completely topless photo then, or bras and bikinis? Are they not helpful?
Oh, so good, so good. Such a good question. Both will be really helpful because
Okay.
what I want to know is that we are talking about the same thing when you are in clothing or in a supportive bra and outside of a supportive bra. Because
Okay.
some women will want to see that upper pole and that shadowing when they wear a push-up bra, but they're not so eager to see that if they're wearing something like a triangle top bikini or a tube top or not
Hmm.
wearing a top. And so I
Hmm.
need to know, hey, is that upper pole something that you're looking for when you're not in a supportive top, or do you want to not have to wear a bra and still see that? And so the answer would be
Hmm.
both. The
Hmm.
photos without a top, so I can see if there's no support, what does it look like? But if there is a top on, what do you want to look like?
Hmm. Um, is there any body style or person, or given what they say in a consult, who you would kind of shy away from doing a super small implant? Like, if they come in and say that, what are the situations where you would be like, look, I really don't think you would actually be happy with a 200 cc. I'm gonna push you a different direction. Not push, but guide you in a different direction.
I think that the type of human who might be disappointed, for example, or might not be super happy with a small volume augmentation, I would say if your primary goal, regardless of your baseline anatomy, if the primary goal is to have a significant increase in cup size, like if you come in and say whatever that cup size is, whether that's a an A to a D or if that's a D to, something significantly larger than that. If you want to notice that increase in cup size, small volume augmentation is probably not going to be the thing that's going to
Hmm.
get you there. If you are looking for a very full kind of implant driven upper pole where like you can really significantly see that, there are some tricks that we can do to get you towards that direction with small volume implants. But if that's going to be the really primary goal, implant show upper pole, small volume implants alone probably aren't going to be the thing that are going to get you
Hmm.
there. In general, if there's a lot of breast tissue, that can be, or a lot of breast relaxation where the
Hmm.
breasts have dropped, say with weight loss, breastfeeding, it can be harder to achieve a really noticeable, worthwhile result with something like a small
Hmm.
volume implant.
I definitely want to talk about profiles at some point, so I need to mentally put a pin in that. But, this was where I was somewhat going to. I have kind of a wider rib cage, and in one of my many implant exchanges, I was like, "Ooh, why don't I go down?" And Dr. Pyle at the time was like, You need an implant a certain width as well. I don't think you would be happy because you would have show." And I was like, oh, that makes perfect sense. I never thought of that though, too. So does BWD, breast width diameter, or taking measurements of the actual size, help also to know, like, hey, that probably wouldn't, a 200 implant would not give you that look you were looking for.
BWD is critical because at the end of the day, the implant has to fit close to or within the footprint of someone's natural breast. And
Hmm.
everyone's natural breast, that's not a thing that you can change. It's not a good or a bad thing. That's just you. That's your anatomy. And
Hmm.
so if you are someone that has a naturally, and this is something that has come up a few times in my consultations already. If you are someone that has a naturally broad chest or a naturally wide chest,
Hmm.
and you come in and you say, I don't want to be any bigger than X number, 220 cc's. Most of the implants that live in that range tend to be narrower, flatter implants. And so they're narrower BWD and they also tend to be a lower profile, meaning they don't stick out as much.
Hmm.
And so it can be difficult in those humans who have a wider chest wall, wider ribs, or a wider breast to find an implant that is proportionate to them while still maintaining a very low volume. And that's where the
Hmm.
BWD and the profile really come into play.
Hmm.
Uh, and so it's critical. There is some play when it comes to BWD and choosing an implant. Because even two different surgeons might measure them slightly differently. If you go to two different
Mm-hmm.
consults, four different consults, you might get four different measurements. But in
Mm-hmm.
general, we try to respect that BWD when it comes to choosing an implant, and that becomes even more important when we're choosing a small volume implant.
Do you think that that's something that women, if they have not had a consultation yet, should stress about? Because I can imagine sitting there at home trying to figure this out
Mhm.
before even having a consult. This is exactly what I want. Or would you recommend finding just some general goal photos, going in for a consultation, and letting you help with that BWD? And then I also want to ask you about other things like 3D imaging and sizers and other ways, because yeah, I think a lot of women try to figure all of this out beforehand to go into a consult and be like, here's exactly what I need, versus it being an emotional conversation that way.
Well, what I would say is, if you knew all the answers, if you knew all the things as the human on the other side, you wouldn't need a surgeon to talk to. Like you just come in and you come in with your checklist of exactly what you need, and then we just say,
Yeah.
okay. But that's not how consults go, right? Like you come in with general ideas, like, hey, this is the look ish that I'm going for, and it's like my job or the surgeon, whoever's on the other end of that table, it's our job to take those photos and those ideas and those goals and those thoughts you have, and we translate those into a surgical plan. And so I think from my perspective, sure, if you've done a lot of research and you know, hey, like I've looked at thousands of photos and I've talked to friends and family who have had this procedure and I have a really good idea, I think that's great, and I think that can really help guide our conversation. But it's okay if that's not the case also. If
Hmm.
you come in and you be like, look, I like this photo. I don't know why I like this photo, but I like this photo. And I'm like, great, cool. Here's what I'm seeing about this photo. Is that what you're liking about that photo? Or tell me a little bit more about that. And so that's why it's a conversation. That's really why I enjoy doing this, because it's
Hmm.
it's about it's about talking to the people. And no
Hmm.
conversation is the same between two people.
Yes.
When it comes to some of those adjunct things, those technologies, I think they can be helpful sometimes. I think they can be not as helpful at other times.
Hmm.
What I would say is, so there's 3D imaging technology like Chrysalix, which is being adopted more widely among the
Hmm.
practices. There are advantages to these. Um, I think that they can. This technology, so you always got to take it with, not a grain full of salt, but like two fistfuls of salt. But they can sometimes help you to get an idea of the thing. That being said, I don't think they substitute the conversation that leads to that thing.
Hmm.
And at the same time, I also wouldn't let that intimidate or change your thought. If you came to a really solid conclusion with your surgeon and then you say plug that into the Chrysalix or whatever imaging,
Hmm.
and it shows something like you're like, I don't necessarily know. I would say like, okay, we can continue to have a conversation about that, but I wouldn't let that completely derail the plan that you had, because at the end
Hmm.
of the day, it's technology, it's fallible. Sizers can be helpful in a different way because it's really hard to 3D imaging doesn't have the ability to for you to look down and be like, okay, this is how this looks, this
Hmm.
is how this feels. That being said, if you have existing breast tissue, there are some subtleties and some nuances that are lost there.
Hmm.
So I think they can help. Any of those kind of adjuncts can help, but I think the most important thing is to have a really honest and open discussion with your surgeon. Take the time. Take the time to talk. If you start going down a direction, you're like, well, actually, I don't know. Like the words that I feel like I'm saying are not necessarily matching with the plan that I feel like we're coming up with. Just stop the conversation and be like, hey,
Hmm.
let's take it back to the beginning and see where does that disconnect happen. Like that's what
Hmm.
we're here for. Like we're not here
Hmm.
to put I'm not here to put my plan on you. Like you're here to
Hmm.
tell your thoughts and we create a plan.
Hmm. When does someone have to officially decide what size they're getting? Or how does that work? Like, do they have to know? Do you guys figure it out at the consultation or
Mhm.
surgery day? Or I know sizers can sometimes be used in the operating room. Can
Mhm.
you tell me that process at Amelia, Tampa?
So really good question. So here at our practice, generally what I'll do is we'll have a conversation about implants at your initial consultation. Usually, I would like to, narrow it down to somewhere between a 50 to 100 cc or so range by the end of the
Hmm.
consult. There's no decisions that have to be made based on that. That's just kind of a rough idea, and then be like, okay, great. Like, let's think about, say, it's going to be like 250 to 325 cc's.
Hmm.
And then what I ask for you to do at the end of that consult is go home, don't even think about implants for the rest of the day if you can help it. Just like percolate on it. Let it marinate
Mhm.
in your brain. And then over the next few days or weeks, look more into those photos that you've been looking and really see, hey, we talked about like 250 to 325. What does a
Mhm.
280 cc now that I know that that's maybe, what does
Mhm.
that look like on someone who's got my frame on something like a Goal Finder?
Mhm.
And then you come back in to see us for a pre-op usually around 2 weeks before surgery, and that's when we really hammer down the implant details. We will go through your
Mhm.
imaging at that point. We'll go through your go photos and be like, okay, cool. What really do we want to try to achieve with this? And that's when we decide the implant.
Mhm.
I have heard of some other folks out in the community, other surgeons out in the community that will bring a range of implants in with
Mhm.
different sizes and say like, hey, I will, we have these sizes ish. I'll decide for you while you are asleep. I
Mhm.
personally tend to shy a little bit away from that approach just because
Mhm.
I don't think it's my role to decide for you while you're asleep what looks good or what you would
Mhm.
like necessarily.
Mhm.
And so I really lean on the conversations that we have beforehand to help
Mhm.
educate us and lead you to the conclusion that would work. Uh,
Mhm.
that's how it
Yes.
generally works for us.
Yeah. That sounds. I like that. I don't think I would personally want any major surprises when I woke up. That it wasn't what I had mentally planned on this whole time.
Yeah, I've heard
Um,
a couple horror stories, so
yes. Um, so that's the size piece, the actual CCs. I know that there are other factors talked about at a consultation with you and a patient, usually determine ahead of time, obviously. There's things like brand. First of all, there's all kinds of different implant brands now. There's profile, which I know we touched on a little bit as well, which I know also very much impacts this. My first augmentation, it was saline. I don't even think there were profiles with saline, at least 100 years ago in the 1900s. But now that I'm going to do my exchange, it's all in my head. Like, oh, okay, do I want more side boob? Do I want that projection? It's a complex, and now there are so many different brands too. And then placement, over versus under. Do any of those other, I want you to give me a quick spiel on each one of those, but then specifically through the lens of small implants. Like, are smaller implants better to put over the muscle? Are they still fine under the muscle? Are there
Mhm.
profiles that are better with smaller implants? Like, this is all very interesting.
So when it comes to small volume implants specifically, like all of those things that we talk about, like you mentioned, with any standard, moderate, or large volume implant, they still come
Mhm.
into play. But I would argue that they potentially matter even a little bit more because a lot of women who come in looking for small volume implants, they don't have a lot of breast tissue at baseline, and they're looking for something
Mhm.
that's relatively subtle. And so, really, what we're doing in those situations is using the implant to create a lot of that proportion and shape rather than relying on a lot of overlying breast tissue. So, what
Mhm.
does that mean? Number one, the profile, which we touched on already briefly, is
Mhm.
really refers to how far does the implant come up off your chest wall. Low profile,
Mhm.
moderate profile, high profile implants. In
Mhm.
general, lower volume implants tend to do better with lower profiles
Mhm.
because they tend to, what we're looking for is an implant that is wide and not super tall and pointy. High profile implants work really well in certain situations, but they tend to be narrower, pointier implants.
Mhm.
And so they tend to really just like, they don't fill out as side to side as much, and they will really project forward.
Mhm.
And so those tend to work better for higher volume implants. Lower volume implants tend to work a little bit better
Mhm.
with lower profile, obviously depending on your base width.
Mhm.
The other things that come into play, the implant cohesiveness. So basically, how
Mhm.
how soft or cohesive, or like how much feel or look does the implant have? That still comes into play certainly with low volume implants. That factors into, hey, are you looking for that super subtle, natural transition? Consider a low
Mhm.
cohesive implant. If you're looking to maximize, like, hey, I want a low volume implant, but I'm also looking to try to keep as much upper pole as I can. That's when we might talk about a low volume implant that's a little bit more cohesive to try to maximize as much as we can get out of that.
Mhm.
Um, from a brand perspective, lots of implant manufacturers offer lots of different options. And
Mhm.
so I think that that's one area where you can have a conversation with your surgeon and be like, hey, look, I tend to like implants from this manufacturer, or hey, I really like what this manufacturer brings to the table in terms of their implant technology or what have you. And so that's one area I would say, like, hey, like, don't stress too much about that. If you're looking for a low volume in a certain profile, we've got someone has something that will match that.
Mm-hmm. Mm-hmm.
And then placement relative to the muscle over versus under. I think that that is also pertinent and relevant, just like it is for any implant. Um, just be aware, under the muscle, if you choose a small volume implant, it can be real. That's the combination of things that can get you that very subtle, very natural, kind of athletic, refined look that a lot of people are looking for these days.
Mm-hmm.
Over the muscle can also work really well because um, we're not putting a lot of weight behind those implants. And so we don't necessarily have to worry as much about that soft tissue stretch and that lower pole stretch that can come with high volume implants over the muscle. So it can be advantageous from that perspective.
Mm-hmm. Talk to me, because you're right. I guess a lot of these women would be the lower body weight, smaller breasts anyway. And as the girl exchanging due to rippling, but now I've got Motiva for over the muscle as an option. Talk to me about rippling and over the muscle, even with small implants, and kind of what options are and what you would recommend if that is a concern for somebody.
Rippling is a thing that happens, potentially that can happen regardless. And I would say it's it is somewhat, some part of it is related to implants, but really the big part of rippling and the main issue with rippling and what causes it is the interaction of the implant with the overlying soft tissue. And so it's a factor of the implant, and it's also a factor of the human's skin and soft tissue that has the implant.
Mm-hmm.
So smaller volume implants don't necessarily eliminate or reduce the risk of rippling. There's a couple of other things that are more pertinent from that perspective. I would say the number one thing is how much soft tissue do you have at baseline? If you're someone that has a lot of rib shadowing, if you're someone that doesn't have a lot of tissue to begin with, then we're going to see more of that implant. And that means that there
Mm-hmm.
might be a slightly higher risk of rippling or wrinkling. Um,
Mm-hmm.
that can be potentially softened by going under the muscle because there's just more stuff between the implant and the skin if you choose to go under the muscle. So that can be used
Mm-hmm.
to kind of soften that. Um, Less cohesive, softer implants tend to have slightly higher rippling risk than more cohesive, rounder implants. And so that's something that can also come into play. That being said, we do a lot of over the muscle soft
Mm-hmm.
implants. It's a very kind of a hot combination of things right now. It's very in vogue.
Mm-hmm.
People who are active, athletic, looking to minimize muscle disruption, but also try to keep something as soft and subtle as possible.
Mm-hmm.
And so I just talk to those folks. Just have a conversation. It's like anything. Just talk to them. It's like, hey, look,
Mm-hmm.
heads up. Like we're choosing this combination of things. We're doing over the muscle to minimize muscle disruption, but we're also choosing a soft implant to try to get you a really soft, natural look. You might be at increased risk of rippling or wrinkling. Just know if it's there, it's not. It's often positional. It's not something that's always there. Much of the time, it's usually something that you might be able to see rather than feel, or feel rather than see. And there are things that we can do to adjust that in the event that it does come into play. Fat grafting,
Mm-hmm.
alloclay, implant exchanges down the road if we have to.
Mm-hmm. Um, it would, I would think that a smaller implant would be an easier recovery or would has less risk for things. Is that true? And is that the reason someone should choose that? But and even longevity, I would think they would last longer or stay up higher.
That's a really good question. I think you're right. Intuitively, it's like in your brain, think like, hey, a smaller implant, I feel like is gonna just, it's like, is it a smaller surgery? And the answer is like,
Yeah.
it's still like surgery is a surgery. I always tell folks, I'm like, hey, look, like this is a thing that you're doing to help you feel better about yourself, to look better and feel more confident. But at the end of the day, it's not a haircut. It is a surgery, and so that's why I ask for you to give yourself the grace and space and time to recover from the thing, even if it is a surgery to help you feel better about yourself. And so what I would say is, at the end of the day, surgery is a surgery. Um, are we doing as much stuff on the inside with a small volume implant as a large volume implant? No.
Mm-hmm. Mm-hmm.
And so what that means is that you might have a little bit less swelling, or it might last a little bit, less long. The drop in fluff might be potentially a little bit less dramatic in
Mm-hmm.
someone who has small volume implants, but that's still going to be a recovery. We're still having to open up that space, put that implant in, and then have you heal up in a way that feels reasonable to you.
Mm-hmm. Okay, good. Yeah, I'm glad you mentioned drop and fluff. I know the bus mob community knows about that, and I was curious if it would be less in an under the muscle implant with a really small implant. But
I mean, what I would say is that it's going to happen regardless. It's going to happen either way. I'd spend additional time because Drop and Fall and Bustmob is so familiar with this concept, and I have to thank
mm,
them because my patients come in so educated about this because of Bustmob. Um, it's I have to really talk people through the drop and fluff even a little bit more for small volume implants because a lot of the time people are going for small volume implants are looking for that subtle natural look.
good
And
point.
you are going to wake up after surgery, even if we put a small volume implant in, that thing is it's going to be dramatic. Like it's going to be like, why? What are these things doing up here? Why are there bricks in my
Yep.
neck? And that still happens even with small volume implants. So with time, just it's the same process. Just it might be a little bit less dramatic than someone who has like say 600 cc's that are all the way up here, but it's probably going to look more dramatic than you think. Still, give it the time, give it the space. It will soften.
Such a good point, because psychologically, they're already looking for a very modest result. So that recovery could be really freaky.
Mm.
I think it's funny. Like I did under the muscle first time. I had none of that like Frankenboob. So it's really
Really?
interesting how it seems to happen to some people and not others. I mean, again, this was the 1900s and they were sailing, so maybe that's the reason. But um, let's talk about Preservé, because what we've really been talking about up till now was a traditional, still the most common, still a wonderful surgery, breast augmentation. But Preservé is a different version and specifically is only for small implants. But can you kind of give us the breakdown and why one might choose one over the other?
Yeah. Well, I think the big thing to understand is first of all the concept behind Preservé. So there is basically a ligament that lives around the breast, circummammary ligament, that for better or worse, we as plastic surgeons over the course of decades have just ignored. Like it's been there, and we've just been like, hey, it's part of the breast, but it's we have to kind of disrupt that a little bit in order to place implants in. The idea behind Preservé, as the name implies, is preserve that circummammary ligament, and so try to minimize the disruption to that as much as possible. Um, and so there's a certain type of person that where that type of concept tends to work better. In general, those are smaller volume implants in women who don't have significant amounts of breast relaxation. And so those are the types of humans where this tends to work better and tends to work well. And a lot of the concepts that we have discussed in terms of small volume augmentation, they really carry over very well to Preservé. These are going to be smaller volume implants that will give you a relatively subtle, natural result. That being said, it's always important to remember with Preservé, because we're disrupting the tissue a little bit less on the way, you can get a more dramatic, more visible result from a smaller sized implant. And so a 250 cc implant placed via Preservé is going to look um, a little bit different. It's going to look fuller, and it's going to look like it's added more volume than a 250 cc implant placed via a traditional breast augmentation. The other really powerful advantage of Preservé is awake surgery. I mean, I think that's for
Hmm.
people who are trying to go in and, high functioning active people. You're just like, hey, I want to do this. I want to get the surgery, and I want to go back to doing whatever I was doing, a couple days later. That's really the crux of Preservé, and I think that's what makes it a very unique and powerful offering, for
Hmm.
sure.
I was so skeptical at first. I'm like, I just don't
Me too.
understand how you can do this awake and it actually be comfortable. But now, like, that has completely been disproven. I've talked to so many women who have had it and were like, it was literally easier than lip filler. And
Hmm.
I'm like, well, that's really amazing. But there are, Preservé is only currently or can only be done over the muscle.
Hmm.
So, right? And what's
That's
the
correct.
maximum implant size you can go?
In general, the implant sizes tend to go up to like the high 200-ish range, maybe
Got it.
even up to the
Okay.
low 300s or so.
Okay.
But so basically, in my brain, it fits into the kind of the category of low volume implant.
Yeah.
Uh,
Yeah.
and so they're obviously just like any other implant, there's a range of rather profiles that are available,
Hmm.
and so you can talk through the different profiles within those volumes. And the other thing to know is that the only implants that are available are the ergo implants, so they're the
Hmm.
softer, kind of more natural implants that are available.
Got it. I think if I was starting over and for the very first time getting my primary first augmentation in 2026, I would
Mhm.
totally do Preservé over the
It's so
muscle. I
powerful,
mean,
and
been
it's so
happy with all of the things I've done, but I really, understanding the anatomy, and you guys have helped me to understand it, I will be very curious to see how those look in 10 and 20 years versus it makes sense that they may last, stay a little higher. I'd be curious if there's issues with bottoming out. And is
Mhm.
there any difference with like breastfeeding with Preserve versus like, I know that there's no real issue with breastfeeding after augmentation, but I would just also think it seems encouraging for younger women to feel more comfortable doing it. It seems so
What I
much
would
less disruptive.
I tend to agree with you. And so I can't quote I'm like a numbers person, and so like until solid numbers are there, I don't I want to hold off on quoting a number. That being
Hmm.
said, intuitively, just like you said, it makes sense, right? Generally, with breast augmentations, if you're the type of human who would have been able to breastfeed successfully prior to a breast augmentation, you should
Hmm.
expect to be able to breastfeed after breast augmentation.
Hmm.
And that's pertinent for traditional breast augmentations. For Preserve, we're doing even less stuff on the
Hmm.
inside. And so my gut leads me to believe that that concept should stand, and if not, be a little bit more valid in the situation.
Hmm.
So 100% agree. If someone who's younger and considering this, but the breastfeeding thing is a thing that's on your brain,
Hmm.
I would really lean on the fact that Preserve preserves as much tissue as we
Hmm.
can.
That's cool. We got a couple different questions about both like mesh. And it was like Galaflex. Can I do mesh at the same time? Do I need mesh if I'm going to do a ballerina augmentation? And I just lost the other question. But let's talk about mesh and then lifts too with a smaller augmentation. Do they have a less of a chance of bottoming out? Do we need a lift? That kind of thing.
So the thing I would say, so Galaflex or in general meshes, is used at least in my practice and in my hands. I try to use mesh selectively in order to provide soft tissue support in specific situations, like for example, significant amounts of weight loss, or if someone has lots and lots of stretch marks where they just know that their skin has lost some of that collagen strength.
Hmm.
That's where things like mesh can come into play. And so, uh, outside of kind of unusual circumstances and someone who's seeking out a ballerina augmentation, I probably
Hmm.
don't think that mesh is something that I would at least recommend for most folks who are considering that. That being said, the lift question is also very relevant and valid here because
Hmm.
just like any other woman who is seeking out a breast augmentation, women who are seeking out small volume augmentations may also have breast relaxation where that breast has kind of fallen or drooped down. And I think that it's really important to discuss like what is a lift good for and what is an implant good for and where do those intersect and what will get me what I'm looking for.
Hmm.
Um, in general, in my brain, I kind of break it into like the top half of the breast and the bottom
Hmm.
half of the breast. So the top half of the breast is really the land of implants. That's where we can accentuate. If you're trying to look for
Hmm.
some volume, if you've got a lot of deflation, that's where the implant lives. And if that's what you're trying to target, implant is the thing, and that's what it's going to do. If you have some, kind of excess weight or bottom heaviness on the lower half of the breast, that's where the lift comes into play.
Hmm.
And so if you're someone who's like, look, I'm looking to have a lot of upper pole volume, but I just want to have a lift, I would say it's probably not going to be the thing that's going to get you there. You're probably going to need to add an implant into there. And so if you can imagine when you combine an implant for the top half of the breast with a lift for the bottom half of the breast, it's a very powerful kind of global
Hmm.
breast rejuvenation. And all of those things are still 100% pertinent and valid with a small volume augmentation as
Hmm.
well.
How about fat grafting to the top of the breast? I'm trying to think of somebody who really doesn't want an implant, and I can understand why some people do not want one. But you're
Hmm.
right, lift only almost never really has any fullness at the
Hmm.
top. So could you do fat up there?
You can. My personal bias with fat grafting alone, I think it's really good in order to kind of correct or adjust small discrepancies that may arise from, say, an implant that's got some rippling or situations like that. That being said, using fat or alloy or any sort of like kind of adjunct treatment in order to significantly volumize a certain part of the breast, it can be a little bit less predictable than using an implant because fat, alloy, all of these types of things, they generally have a 50 to 70-ish% survival rate. So we have to overfill that area,
Mm-hmm.
and and then kind of rely on some of that to disappear and dissolve over time. So if
Mm-hmm.
you're using it for significant volumization, it's just a little bit harder to predict that end result. So
Mm-hmm.
that's why I think it's really powerful as a fine tuning device, but as fat grafting alone to add significant volume, it can be tough to do it really well.
Mm-hmm.
If I add, say, a 250 cc implant, I know like there's 250 cc's and they're going in and they're staying right there.
Yeah.
If I fat graft in 100 cc's of fat, maybe 50 cc survives, maybe 60 cc survives on one side, and maybe a little bit more survives on the other side. It can be hard to get a really precise result with that.
Yeah. That makes sense. Incision wise, I think the most common is inframammary at this point. Just putting in an implant, no lift, is my guess. The under the breast crease. Um, is that true at your practice? Like that's usually where you end up putting the implant in.
Yes, that's
Is
correct.
Yeah. If I'm choosing a 200 cc implant, let's say over a 500 cc implant, is my incision smaller? Like, is that another advantage, or is it still about the same size?
That's a great question. What I would say is not necessarily.
Okay.
Um, the the incision length that we choose isn't like direct function of the actual implant volume itself. It relies on like, hey, what kind of implant type are we using? Are we using a super soft, tiny implant that's really malleable that we can
Mm,
squeeze through a small incision? Are we using a more cohesive implant that's not going to squeeze as effectively, where we need a little bit more space? But in general, scars, the inframammary scar from an augmentation, in my practice tends to be like it's like a 2.5 inch scar that lives underneath the
mm-hmm.
fold, tends to hide really well, and people heal really well from it. So
Mm-hmm.
can I so I guess short answer is, can we get a smaller incision with a small volume implant? Like maybe like a tiny bit, but
Mm-hmm.
it's not gonna be the difference between like a tiny scar and a big scar. The scars will be
Mm-hmm.
pretty similar regardless.
Yeah. And those are so, I mean, for most people at least, you can't even find them at some point.
Mhm.
It is shocking that how you guys figure out how to put it right in that crease. So I had nothing when I had my
Is that
surgery. And so I'm like, they were like, well, we're going to put it in the crease. I'm like, what crease? And
right?
the math y'all have to do to figure
Yeah.
out exactly where that crease was,
Yeah.
like I would have put it probably way too high. It's wild that it is perfectly under there. And now I can't see it at all. But yeah, for those of you who don't have a crease, you do get a crease, which is really cool.
Yeah,
Um,
we'll find it. We'll make it. We'll place it right in there.
yes. Uh, okay. I know I do not want to take up too much of your time. I'm so grateful. I've got one more good question.
All right.
These were so many great questions. I think I tried to hit. Oh, wait, this is a good one. Let me get this one. Is a subtle change like 150 to 200 cc's, and I'm not even talking about just their initial augmentation, but like I get that question a lot. I want to go bigger or I want to go smaller, but I'm a value girl. I better be
Mhm.
able to feel it, see it, get excited about it. What do you talk to patients about that number of like, is 100 cc's worth it? Is it 200 cc's? Um, Says the exchange girl too. You will never have that same reaction as the first time. I went from 0 to 275, and that was great. But 275 was too small. So I went up to 375. I barely noticed. I wore the same bras, the
Mhm.
same everything. And it gave me my first indication of like, oh, I didn't have to
Mhm.
pay for it. But had I paid for this, would that have been worth it? I don't know. So, how do
Mhm.
you navigate those CC conversations?
I think that the difference between CCs is really important, but it's also very patient dependent. I think the
Mm-hmm.
better question to really decide for the human who's on the other end of this to really hammer down is, hey, is is this change that we're looking for, is that going to accomplish something meaningful that you're actually looking for? So if we're exchanging implants, yes, the general rule of thumb, including with myself in my practice, is 100. If we're going to change it, we should change it by 100 cc's at least. That being said, if you come in and you're like, hey, I'm looking to have larger, like I want larger volume implants, 100 cc's is probably not going to be the answer. It's probably not
Mm-hmm.
going to be the answer. Probably depending on your, you know, anatomy and what you have in, it's probably going to be 150, 200, maybe even a little bit more than that.
Mm-hmm.
And so the question of, like, hey, when is it worthwhile? I think really depends on where you're at and where your goal is. And if we if that 100 cc is that number. If you come in and be like, look, it's close, like it's close and I love it, but like I want it to be just a little bit more, then people are like, yeah, let's, I think 100
Mm-hmm.
cc's can do the thing. But
Mm-hmm.
in many women that answer is it's a little bit higher.
Yeah. Well, let me ask you then in the reverse, since that's what I'm thinking about. And I do think that there's a lot of us, at least I connect with a lot of women who are of my similar age. We've all had implants for 20 years. Maybe we're microdosing GLP-1s now and we're a little smaller and we want to go smaller. Well, when I had my consult, it was like, okay, we could go about 50 cc's smaller, but after that, you're going to need a lift.
Hmm.
Or, like talking. And so that's been an interesting, I'm like, do I want to lift? I don't know. Like, is there usually a cc amount that to decrease requires a lift, or are there other options like pocket tightening, or how do you know how to downsize and have that conversation?
It's a really hard one, and this is this is welcome to my life. This is
Sorry.
these are big level conversations, and they're really important to discuss. What I would say is there's no CC number in order to say like, hey, I can't see someone be like, hey, look, you're gonna need to go if you go down by X amount of CC, you will need a lift. Like universally, human to human, there probably is a number that we could talk about individually, but universally, there's not a big picture number.
Hmm.
What I would say is it really depends on how much the overlying breast tissue has stretched. And I think that that's going to be the big. What is the baseline nipple position? If the nipple is already relatively low and you remove the implant, as you can imagine, obviously the nipple is going to become even lower. If the
Hmm.
nipple is relatively low and you put a smaller volume implant in, it is going to drop a little bit more.
Hmm.
And so I think for folks, I really try to talk through, hey, are you okay with a smaller volume implant and also a slightly lower breast or a slightly lower nipple? And if the answer is yes, then I'd be like, okay, cool. Like, let's swap out, let's downsize the implants, and I think that's good.
Hmm.
But oftentimes we have that discussion with folks, and they're like, look, I want a smaller volume implant, but like, I'm not okay with a smaller and saggy boob. Then that's where we're
Yeah.
like, all right, let's talk about downsizing and also doing the lift at the same time.
Yeah. I love that you love these conversations too, because as a patient care coordinator, I do too. It's fun to
Yeah,
like talk through,
it is.
um, because it's not what you would want, it's what she is comfortable with. And even this one with me, I am like having my own identity crisis of, okay, well, I'm this age now. Do I need them up here?
Hmm.
And it's been a fun exercise so far. So, spoiler alert, I think I'm going to go no lift, go a little bit smaller. So, we'll see.
All
I'll get
right.
those motivas. So, I'm excited.
So good.
Um, all right. What's one piece of advice you'd give someone who's leaning towards a smaller implant, but is afraid of the whole mantra in Bustmob, you know, go bigger, you're going to regret it, boob greed. Like,
Mhm.
that is so true for some people, but at least I want to say, like, that is not true for everybody. But it has become this kind of rally cry sometimes that you're going to have regrets. Um, yeah, is there anything you can say or how you would have that conversation with someone who is worried about that?
What I would say is when it comes to small volume augmentation, I would treat this almost like I would when I'm talking about someone who's looking for a lot of volume or large volume augmentation, just the other end of the spectrum. So
Hmm.
when I talk to folks about large volume implants, I usually will say, hey, like some people would do well with the largest volume implant that they can accommodate, and that's what they're going for, and that's fine. But in general, probably don't need to go for the absolute largest volume implant that you can accommodate. And on the same end of the spectrum, you probably don't necessarily need to choose the smallest volume implant that you can accommodate. I think it's more important instead of getting hung up on that real specific number is to look to find something, talk to your surgeon, like what do I feel like is going to match the result that I'm trying to create? Like
Hmm.
if that is a 220 cc implant after that discussion that you've had with that surgeon, then I think that that's a fantastic choice. Um,
Hmm.
if you have to get if you're like, well, from a base width perspective, there's surgeons like, I really think that a 250 cc might be a better fit for you, then I think that that's a conversation that you have at that point. um, like, and it's kind of, it's all the time on Bustmob, the discussion about don't get hung up on that cc number. 20
Hmm.
cc's, it's a little bit more than a tablespoon. Yes, that is going to be a little bit more visible on a 200 cc implant versus a 220 cc implant compared to say a 500 versus a 520. But that being
Hmm.
said, I'm really confident in saying that like that 200 versus 220 is not going to be the difference between a good result and a bad result.
Hmm.
What I say is like often what I'll do is I'll present folks with two or three different options. Like, hey, let's say a 200, a 220, and a 240. And then we'll just say each one, hey, like 200 cc's. Like, how does that feel? And often people will have a little bit of a gut, either yes or a gut reaction no. And I think that I really use that to help guide me. Be like, as you go to sleep tonight, be like, hey, say we put in a 220 cc implant. Does that feel good, like in your brain?
Mm-hmm.
And often people will go a few different directions. It'll be like, yes, like like that in my brain that scratches that itch and that feels good. Or they'll be like, can we go a little bit more? Be like, yeah, let's go with 240. Or be like that number's just it's a little intimidating. I mean, let's go with 200.
Mm-hmm.
So that's really, I think that once we narrow it down to a relatively, short range, your gut, your brain will tell you where it wants to go. And I think any one of those choices would be reasonable. When I present people with, say, three different implant sizes, I always tell them, like, hey, look, just because there's three choices here doesn't mean that there's one right option and two wrong options. It's probably just three different versions of the right thing. And it's just a matter
Yes.
of what fits better with you.
Yeah. And I think everybody wants to only do this one time. Of course, we want to nail it for her sake, for our sake, for everything, everybody's sake. But I used to spend a lot of time telling women, at least, like implant exchange as possibly the queen of them, doing it under local, at least, especially, hopefully, you'll have these for a very long time. When I was 25 and I got my first set, that's what I was like, I have to get this right. Well,
Mhm.
now it's been forever and I've had all the different sizes. Like, if you don't nail it, it's not the end of the world either. Your body might change, your life, you will change. It will change your lifestyle, even maybe your husband's fashion, your clothes, how often you go to the gym. And so we're going to do our best to get it right. But if in 5 years it's not right, you can exchange them for usually, I don't want to speak for you, but mine were so incredibly easy. And I was so grateful to have that as an option that I'm just like, relax a little bit. We can
Mhm.
always change it. So,
I think I try to almost consider it like implants, like it's like a tattoo, right? It's like a reflection of who you were at that time in your life when you had it
mm,
done, right?
love
And
that.
so, right, and so when you got whatever that tattoo was, like that was permanent and valid to you, and just like that, when you got that implant done, like that was relevant to who you were as a human, and people's stories change. That doesn't make it less valid for who you were at that point, and so
Hmm.
swap them out. And that's so as your life changes and it becomes part of your story, you can exchange the implants as well.
That's my favorite thing I've heard all day. I've had a lot of lives then. I've had a lot of identities, and that's fun. I'm
Mhm.
not a tattoo girl. It's so funny. I've never understood that because I'm like, ooh, that looks painful. And they're probably saying
Mhm.
the same thing about implants
Yeah,
and
just
plastic surgery.
Mhm.
Yeah, it's a fun conversation to get to have with women. So yeah, thank you for diving deep on especially a lot of the mental aspects of this and not just the facts. You do a wonderful consultation, and any woman would be happy to sit and get educated by you through this process. So thank you for sharing that with
That's really
us.
kind of you to say. That's really kind. There's
Stay inside down there. Say hi to everyone for us. Thank you from the Bus Mob community always.
of course.
And if anybody wants to watch this in its entirety later, it'll be on YouTube. I highly recommend following Dr. Sandhu on Instagram. It's dr.sandhu.amelia. Your team puts out some great content. You put out some great education for people. And yeah, it's fun that we're talking about the entire spectrum of sizes for people. So thank you, sir.
Thank you for your time. This was super fun. I enjoyed it a lot.
Good, me too. I'll see you soon, Dr. Sandhu.
Okay. Take care.
Bye.